Hey, good morning. Welcome to this morning's Irons with Fire safety session. Today, we're going to discuss something much needed in the workplace, and that is your knowledge of bloodborne pathogens. So sit back, relax, and learn. Definition and types of bloodborne pathogens. Pathogen transmission risks. Understanding the transmission risks associated with bloodborne pathogens is crucial for implementing effective safety protocols, particularly in construction settings, where exposure can lead to severe health consequences for all personnel in the area. Bloodborne pathogens such as hepatitis B, hepatitis C, and HIV are microorganisms that can cause disease and are transmitted through contact with the infected blood or other bodily fluids. In construction settings, risks arise from needle stick injuries, cuts, or contact with contaminated surfaces. Effective safety protocols include using personal protective equipment, PPE, proper disposal of sharps, regular hand hygiene, and training to staff to handle exposures promptly. Modes of transmission. Direct contact risks. Bloodborne pathogens can be transmitted through needle stick injuries and contact with open wounds. Surface contamination. Contaminated surfaces can harbor pathogens, necessitating regular cleaning and disinfection in construction settings. Medical waste management. Proper disposal of medical waste is essential to prevent indirect transmission of bloodborne pathogens. Hepatitis B, hepatitis C, and HIV. Transmission awareness. Understanding the specific transmission routes of hepatitis B, hepatitis C, and HIV is essential for effective prevention strategies, particularly in high-risk environments like construction sites and healthcare facilities. Public health implications. The presence of these pathogens poses significant challenges to public health, necessitating ongoing education, vaccination efforts, and stringent safety protocols to mitigate their impact on communities. Risk factors in vulnerable populations. Occupational hazards. Construction workers face increased exposure to bloodborne pathogens due to possible site and work-induced contact with blood, necessitating rigorous safety training and protective measures. Substance abuse risks. Intravenous drug users are particularly vulnerable due to needle sharing, highlighting the need for harm reduction strategies and education on safe practices as to not use illegal drugs. Chronic illness vulnerability. Individuals with compromised immune systems are at greater risk for severe infections from bloodborne pathogens, underscoring the importance of targeted health interventions. Overview of OSHA's Bloodborne Pathogen Standard. Regulatory framework importance. The OSHA Bloodborne Pathogen Standard establishes essential guidelines for protecting workers from exposure to infectious materials, ensuring a safer work environment across various industries. Comprehensive safety measures. The standard mandates the implementation of exposure control plans, universal precautions, and personal protective equipment to minimize risks associated with bloodborne pathogens in the workplace. Employee training requirements. Employers are required to provide ongoing training and education on bloodborne pathogens, ensuring that employees are informed about risks and proper safety protocols to follow. Employer responsibilities and compliance. Exposure control plan necessity. A well-defined exposure control plan is essential for identifying risks and implementing effective safety measures to protect employees from bloodborne pathogens. Vaccination and health support. Employers must provide accessible vaccination options and health support to employees at risk, reinforcing a commitment to workplace safety and employee well-being. Mandatory employee training. Regular training sessions are crucial for educating employees about bloodborne pathogens, ensuring they understand risks and safety protocols to minimize exposure. Employee rights and training requirements. Right to safe environment. Employees are entitled to work in an environment free from recognized hazards, including bloodborne pathogens. Access to training resources. Employers must provide comprehensive training materials that are easily accessible to all employees. Confidentiality in health records. Employees have the right to confidentiality regarding their medical evaluations and exposure records. For this topic, I kind of want to talk to you guys about this real quick. Here at Irons with Fire, we work and value your right to a safe environment. That's why when it comes to the work of all of our team members, we work extra hard to ensure that the environment is free of recognized hazards, including bloodborne pathogens. That is why you'll see every truck should be outfitted with a first aid kit with responsible bloodborne pathogen kit inside of it, including extra gloves, extra bandages, and extra tape to help in the event there is a situation. Access to training resources. We have everything available for your training on TrainDuel. That is where you'll find all your extra training resources you'll need. And of course, if you ever have questions, you can always reach out to your EHS department and we'll be more than happy to help you out. Confidentiality and health records. There's only 2 personnel in Ironton Fire that will have access to anything that has to do with your health, and that is EHS department, myself, and your HR department. Other than that, your health is not of anybody else in the company's importance. For any questions, please contact HR and EHS about any questions with this topic. Importance of exposure control plans. Health risk mitigation. Exposure control plans are vital for identifying and minimizing health risks associated with bloodborne pathogens, ensuring that employees are informed and protected against potential exposure hazards. Regulatory compliance assurance. Implementing an exposure control plan not only fulfills OSHA requirements, but also demonstrates an organization's commitment to maintaining a safe workplace, thereby reducing liabilities and enhancing employee trust. Personal protective equipment and safe practices. Importance of PPE compliance. Adhering to PPE guidelines is crucial for minimizing exposure risks, ensuring that employees are protected from bloodborne pathogens and maintaining a safe working environment for all. Regular training and updates. Continuous education on PPE usage and safety practices is essential, as it empowers employees to recognize hazards and respond effectively to potential exposure incidents. Integration with safety protocols. PPE is part of our comprehensive safety strategy that includes hygiene practices and proper waste disposal, enhancing overall workplace safety and health standards. Procedures for handling exposure incidents. Critical incident response. Immediate and systematic response to exposure incidents is vital. It includes assessing risks, utilizing PPE, and ensuring prompt medical evaluations to minimize health risks and ensure compliance with safety regulations. Here's an example. Bloodborne pathogens exposure from a cut. A team member lacerates their hand on a sharp edge during sprinkler maintenance, potentially exposing themselves to blood from a prior injury site. Immediate response. The risk is assessed by checking for visible blood and contamination. The worker washes the wound with soap and water while wearing nitrile gloves, PPE. Systematic response. They receive a medical evaluation within hours for potential hepatitis or tetanus risks, with follow-up testing logged per OSHA's bloodborne pathogen standard. Importance of vaccination and health monitoring. Vaccination and health monitoring are essential components in reducing the incidence of bloodborne pathogens, enhancing individual immunity, and fostering community health, ultimately leading to lower health costs and improved public safety outcomes. Now, I know many of you are going to ask me, Robert, what does this mean? Well, I want you to think of vaccinations and health checkups like a shield and a lookout for our team. They protect us from serious germs that can spread through blood, making each of us tougher against sickness. When we're all healthier, it's like the whole workplace gets stronger. Fewer people get sick, we save money on doctor visits, and it keeps our work environment safer and running smoothly. And of course, for any questions, please don't be afraid to send me an email or drop me a text or a phone call. Thank you. You've reached the end of our bloodborne pathogen training. I hope this has helped to increase your knowledge base and has kind of offset any questions you may have. But as always, if you have any questions, please contact me. My email is listed above and my cell phone number is available on TrainDuel. Thank you and have a good day.